Greetings everyone. Today let's unravel the wonders of knee anatomy using this bone model. It's like a backstage pass to the complex dance of bones, ligaments and cartilage in your knee. Our lead performers are the femur and tibia. The femur, your thigh bone, gracefully meets the tibia, the shin bone, forming the primary components of the knee joint. Together, they create a fundamental movements like walking, running and bending. Now, let's highlight the unsung hero, the cartilage. Over the femur and tibia, the smooth tissue acts like a cushion, ensuring frictionless movements and absorbing the shocks that comes with every step. In the heart of the joint, we find menisci, two crescent-shaped cartilage. They are the unsung heroes, acting as a shock absorber, distributing the load and promoting the smooth movements. Diving deeper, we encounter ligaments, the ACL and the PCL. The anterior cruciate ligament safeguards against the tibia sliding too far forward, while the PCL, the posterior cruciate ligament, prevents excessive backward movement. The medial collateral ligament and the lateral collateral ligament contribute stability on the sides. Time to shine a spotlight on the muscles, the quadriceps and the hamstring. The quadriceps at the front extend the knee while the hamstring at the back flex it. Their coordination ensures the fluidity of the movements. Now let's address some common knee challenges. Let's talk about the most common knee challenge that we face in clinical practice. Osteoarthritis, a concern for many involving the gradual wear and tear of the cartilage, leading to pain and stiffness. So, in advanced arthritis, the cartilage is lost whenever patient tries to move knee bones rub onto each other. This will produce great pain and stiffness. Injuries to the ACL and PCL can be like a plot twist, often occurring during the sports. These injuries can significantly impact the stability and the function of knee. Meniscal tears are another plot twist. Often due to sudden twist or impacts, they can lead to pain and hinder the smooth motion of the joint. Now, after bone model, let's try to classify the arthritis on X-ray. On top, we have femur and at the bottom, we have tibia. Here, we have lateral and medial joint space. So, on X-ray, we can't visualize the cartilage or meniscus. Therefore, we see clear space between the two bones. As the arthritis progresses, we can see the narrowing of this joint space, and in advanced disease, the joint space is almost lost. So, in every movement, the bones are rubbing over each other and producing great pain and stiffness. Hello friends, today we are exploring knee exercises for various conditions, but safety first. Consult a healthcare professional before starting any new routine, especially with the knee concerns. We want you to enjoy these exercises worry-free. Begin with a good warm-up, a gentle wake-up call for your knees, preparing them for exercises ahead. Form matters. Pay attention to the techniques. It does not only boost the effectiveness but also prevents injuries. Take it slow. These exercises are companion on a journey. Start at a comfortable place, then gradually amp it up. Quick note on the sensations. Discomfort is normal, but a sharp or persistent pain signals a red flag. Pause if needed. Breathe, inhale, exhale. It's your rhythm, syncing up with the movements for a smoother experience. Consistency is a key. Make these exercises a routine. The more consistent you are, the greater the benefits. Now, knee conditions. These exercises fit various scenarios, be it osteoarthritis, patellofemoral pain syndrome, post-surgery recovery, ACL, PCL, meniscus tears. From osteoarthritis to the tears, these exercises are your ally. Individual responses vary. Tailor intensity, and if uncertain, consult your healthcare provider. We are here for your fitness journey. Let's dive on to the first exercise. So, for the first exercise, lie on your back, place a small roll under the knees and let's dive in. Lift one leg at a time, straighten the knees and keep the roll in place. Focus on full knee extension and control movements. Repeat on other side. You should feel the tension in front of your thighs. This will strengthen the quadriceps and improve the knee extension flexibility. For an added challenge, use a thicker roll, maintain a straight back for proper form. Aim for 3 sets of 15 repetitions for each leg. Now we'll work on improving terminal knee extension and stretching the back of your knee muscle. Grab a strap, find a comfortable supine position on a mat, place a small roll under your knees for added support. Secure the strap around the foot, creating a gentle connection. Now let your leg extend fully, feeling the gentle pull from the strap. If you want a deeper stretch, adjust the tension of the strap while giving downward pressure over the knees. Take it slow, find what feels good for your body. Hold the stretch for 15 to 30 seconds on each leg, letting the gentle pull of the strap work its magic. Repeat this for 2 to 3 times. For the next exercise, grab a chair and some resistance band. Sit comfortably on a chair and secure the bands around your ankles. Now extend one leg forward against the resistance of the band. Feel that burn in your quadriceps. Throughout, sit tall, engage your core, and focus on the control movements. This is about quality over quantity. Aim for 3 sets of 15 repetitions on each leg to start, just as needed, and challenge yourself as you go. For the next exercise, lie on your back, wrap a towel around your knees and secure the bands around your ankle. As you gently pull on the bands, bring your knees toward your chest. This stretch is like a little hug for your knees, promoting flexibility and easing the tension. Feel free to adjust the tension of the strap for the deeper stretch. Keep your back pressed gently against the mat. Breathe into this stretch. Enjoy the sensation of the stretch without pushing too hard. Hold this stretch for 15 to 30 seconds, allowing your muscles to relax and release. Perform 3 sets of 12 repetitions for each leg. In next exercise, stand tall with the resistance band secured just above your ankle. Now lift one leg out to the side against the resistance of the band. Remember, it's all about progress, not perfection. Keep your upper body straight, shoulder relaxed, and focus on a controlled movement. Quality over quantity is the name of the game. Aim for 3 sets of 15 repetitions on each leg, adjust as needed, and gradually increase the intensity as you get stronger. For the next exercise, the clamshell, grab your bands and let's get started. Secure the resistance band just above your knees. Now lie on your side with hip and knee bent at a 45-degree angle. As you lift the top knee against the resistance of the band, feel those glutes working. This exercise targets your hip abductor, giving you the burn that we all love. Aim for 3 sets of 15 repetitions on each side, adjust as needed. Pro tip, rotate with the heels, hand on pelvis, do not rotate the pelvis. For the next exercise, lie flat on the floor, engage that core and get ready to lift those legs straight up. Feel it in your lower abs and thigh. Control is the name of the game. Lift and lower with purpose. Focus on quality of each rep. You can modify this if you feel too much tension with your knees slightly bent. You can add a resistance band or weight at your ankle for added pressure. Aim for 3 sets of 15 repetitions on each leg. Adjust the intensity to your comfort and let's keep those legs moving and strong. Now strap that resistance band just above your knees. Get into a crab walk position, feet wide apart, knees bent, and those resistance bands are ready to add some spice. We are moving laterally, targeting those abductors. As you step to the side, feel the resistance from the band challenging your abductors. We are toning those outer thighs and glutes. It's a lateral dance of strength. Experiment, customize the intensity. Remember, it's all about making this workout work for you. Keep the core engagement in a low stance and feel the burn as you move laterally. Aim for 3 sets of 15 repetitions on each side, adjust as needed. Now lie on your back with band above your knee, bend your knees and place your feet hip width apart. Bend adds a dynamic challenge to our classic bridge exercise. As you lift your hips towards the ceiling, press against the resistance of the band. Feel the squeeze in your glutes. Experiment with the different bend resistance, keep your core engaged, press through your heels, and maintain a straight line from the shoulders to the knees at the top of the bridge. Controlled movements for maximum impact. Aim for 3 sets of 15 repetitions, adjust the intensity as needed. Next, find a clear wall and stand with your back against it. Your feet should be about a hip apart and your entire spine should be against the wall. This is your starting position. As we slide down the wall, focus on bending your knees and lowering yourself into a seated position. For starters, you can limit the range of motion and gradually work your way down. Engage the core, keep your back flat against the wall and ensure that your knees are tracking in line with your toes. To get up, use your hand, don't try to slide up. Aim for 3 sets of 12 repetitions, adjusting the depth based on your comfort and strength level. As always, listen to your body. Now we'll start with the classic calf raise. Stand with your feet hip width apart, engage your core and simply lift off your heels off the ground. raising onto the balls of your feet. Feel the contraction in your calves. Now for a challenge, lift one foot off the ground and raise the heel of the standing foot. If you need some support, you can use chair for balance. Great job. Now let's level it up with the elevated calf raise. Find a step or elevated surface, place your balls of your feet on the edge. Now lower your heels below the level of the step before rising back up. This variation adds an extra stretch and intensity. If you are a beginner, start with standard calf raise and gradually progress it to single leg, then elevated with a single leg. Listen to your body, adjust as you need. For each variation, aim for 3 sets of 15 repetitions, adjust the intensity and challenge yourself as you go. For next exercise, for the starters, start with both feet on the ground and gradually progress to the single leg version. It's all about finding the challenge that suits your fitness level. Keep your core engaged throughout the movement and make sure your hips are level as you lift. Control is the key, warriors. Aim for 3 sets of 12 repetitions on each leg. Adjust the intensity based on your comfort level and gradually increase as you get stronger. Next, lie down on your stomach with the resistance band looped around your ankles. As you engage your hamstring, bend your knees, bringing your heels toward your glutes against the resistance of the band. Feel the squeeze in your hamstring as you flex. If you're new to this, start with a lighter resistance band and gradually increase as you get stronger. Remember, it's all about progress, not perfection. Don't rush it, quality or quantity. Aim for 3 sets of 15 repetitions, adjust the resistance to challenge yourself while maintaining the good form. So here is a pre-made schedule for your knee exercises. Remember, it's for you. You can modify it according to your needs. Increase or decrease sets and reps as you need. Include different exercises to target various muscles. Allow at least 1 day of rest to rejuvenate. Additional rest can be adjusted. If you like this video, do share to the patient who can be benefited from this. As always, like, share and subscribe for further more content. Thank you so much.